Hello, everybody. This is a community information presentation on the sexually transmitted infection, syphilis. Um, Speaking in this presentation is myself. My name is Daryl. Also, there is Monique, David, and Jay. This is an overview of what we'll be talking about in this presentation. We'll look into why it's a major concern, as well as the vulnerable populations, what syphilis is, including the microbe that causes it, the infection route, and pathology. And then we'll go into treatment and management of the infection and disease. And then to end it, we will be giving you resources on where to seek help and treatment, as well as additional information. In 2017, as reported by the Stockton Record, San Joaquin County was number 2 for syphilis behind San Francisco, with an incident rate of 50.9 cases per 100,000 people, and is the highest in women ages 15 to 44. Nationwide, the Centers for Disease Control ranked California in third place at 17.1 cases per 100,000, Nevada second with 20, and Washington, D.C. the highest at 40.2. To give you an idea of the severity of infection, in 2000 and 2001, the national rate of syphilis was 2.1 per 100,000. The most recent statistic from 2017, the CDC has the national rate at 9.5 cases out of 100,000. This is an estimated 73% increase since 2013. Rates of infection in women have also increased and is a major concern due to congenital syphilis, explained further on later. According to the World Health Organization, worldwide it is estimated that 1 million people are infected daily. Who's at risk? Syphilis does not differentiate between genders or sexuality. Anyone can be infected. Most vulnerable are pregnant women, as it can cause stillbirth or be passed on to their infants. Those who suffer from homelessness are at increased risk. Risky behaviors such as unprotected sex and having multiple sexual partners increases the chances of contracting syphilis. In some cases, not knowing you're sick helps it spread. Some have stated lack of knowledge in recognizing signs and symptoms as a reason they accidentally infect others. Lastly, the lack of medical access and resources puts you at risk, which is a big issue among homeless populations.
Syphilis is an infectious disease that is caused by a bacterial spirochete called Treponema pallidum. If the disease does not get treated, it can progress through several different stages that can result in a variety of serious health problems. Those problems can include cardiovascular and neurological diseases and even blindness. Syphilis is typically spread through sexual contact with an infected person. It is usually contracted through intercourse. However, infections can also occur with direct physical contact through open wounds or lesions from an infected person and breaks in the skin or mucous membranes of an uninfected person. Syphilis can also be transmitted through blood transfusions or during pregnancy. It can spread transplacentally to the fetus or when the fetus comes through the birth canal and comes into contact with an active genital lesion during delivery. Treponema is a very tiny organism that cannot be seen on light microscopy. It can only be identified from its distinct spiral movements on dark field microscopy. The incubation period is about 20 to 90 days. And it invades the CNS early, but symptoms don't appear until late. Outside of the body, it does not survive for long.
This is Monique, and I'm going to go over the diagnosing and treatment for syphilis. The signs and symptoms of syphilis will vary depending on what stage of the disease the person is at. So the first stage is the primary stage, and the typical first sign for that is called a chancre sore. And that develops on the area of the body where the bacteria entered. This can be the vagina, the penis, the rectum, or the oral cavity. And by oral cavity, that can be the lips, the tongue, the gums, the tonsils, anywhere in the mouth. And the canker sore is not always noticeable because it tends to be painless, and it can be in an area that's hidden and not easy to see, such as inside the vagina or inside the rectum. And the canker sore will develop after about 3 weeks of exposure, and it will heal on its own within 3 to 6 weeks. Now that's just the canker sore healing. That doesn't mean that the syphilis is cured within 3 to 6 weeks. And also, it is possible for somebody to have more than one canker sore if syphilis entered the body through multiple regions. The upper right-hand corner shows an illustration of what a canker sore looks like on a penis, and that's typically what a sore would look like anywhere on the body. If no treatment is sought out, then the syphilis will advance to the secondary stage, and that will usually start within a few weeks of the canker sore healing. And the main symptoms you see during the secondary stage is a large rash that appears on the chest, and it will begin to spread over the entire body, and it can even go to the palms of the hands and the soles of the feet. In the bottom right-hand corner is a picture of the rash. It's typically not itchy, but you do have wart-like bumps that appear on the mouth or genital area. Additional symptoms you may see are muscle aches, fever, sore throat, and swollen lymph nodes. And the secondary stage may resolve in a few weeks. However, the symptoms can continue to appear and resolve for up to a year. After the secondary stage, if still there is no treatment, the syphilis will enter the latent stage. And during the latent stage, the syphilis basically becomes hidden. No symptoms are appearing, and it can last for multiple years. If no treatment is sought after the latent stage, the syphilis will advance to the tertiary stage. The tertiary stage can appear about 10 to 30 years after exposure to syphilis if no treatment was sought after. The tertiary stage is when a lot of the complications arise because the bacteria begins to spread through multiple organ systems throughout the body, typically the brain, eyes, heart, nerves, bones, joints, and liver. So again, the complications from syphilis occur during the tertiary phase of the infection, and they can become fatal. The complications occur from organs being damaged when the bacteria spreads throughout the body. And the damage done to the body varies depending on the organs being affected. So for example, syphilis can invade the nervous system, and that will cause headaches, altered behavior, difficulty coordinating muscle movements, paralysis, sensory deficits, and dementia. Syphilis can also invade the eyes and cause vision changes, decreased visual acuity, and permanent blindness. Syphilis can also be passed from a pregnant woman to her unborn baby, and exposing the unborn fetus to syphilis can cause serious damage and even death. Up to 40% of pregnancies that involve a syphilis-infected mother result in infant death. Babies that are born alive must be tested and treated immediately to prevent death, developmental delays, and/or seizures. Any pregnant woman that tests positive for syphilis must take penicillin to treat the syphilis and help prevent adverse birth outcomes. How to get tested. Diagnostic testing should be sought out if signs and symptoms of syphilis are seen, if a sexual partner has tested positive for syphilis, or if a woman becomes pregnant. Some people will also do routine screening for syphilis just to be safe, or to double check and make sure that they don't have any STDs before having sexual contact with a new partner. To diagnose syphilis, 2 blood tests are done that look for antibodies in the blood. Antibodies are proteins in the blood that are able to detect and help attack certain antigens, which are like the bad guys, like syphilis. The first test done is the non-treponemal test. This looks for antibodies from damaged host cells, but it's not specific for just syphilis antibodies. So if that test comes back positive, the treponemal test is performed, which looks for the syphilis-specific antibodies in the blood. If the treponemal test comes up positive, then that confirms a case of syphilis. So when a person is diagnosed with syphilis, they will need to seek out medical treatment. Because syphilis is a bacterial infection, antibiotics are the treatment. The antibiotic that syphilis is treated with is called benzathine penicillin G, and it is given through an intramuscular injection. If the syphilis is diagnosed in the earlier stages of the disease, one dose of the benzathine penicillin G will most likely treat the syphilis. However, if it's not diagnosed until later stages, 3 doses of the penicillin will need to be given, and it's given at a rate of 1 dose a week for 3 weeks. Some people are allergic to penicillin, so doxycycline and ceftriaxone are alternative antibiotics that can be given. However, if a female is pregnant while being treated for syphilis, penicillin is the only antibiotic of choice because doxycycline and ceftriaxone can cause further fetal damage while pregnant. So if a pregnant female has a penicillin allergy, they will be placed on penicillin desensitization, which allows the antibiotic to be broken down into smaller doses that will most likely not trigger an allergic reaction. Medical treatment is not the only type of treatment a person diagnosed with syphilis should seek. They should also get mental and emotional treatment. Being diagnosed with syphilis is very shocking and upsetting for a person. They can feel angry towards their partner or betrayed. They might feel embarrassed or ashamed, and they might feel guilt over possibly spreading the disease to others. So people diagnosed with syphilis are encouraged to find mental and emotional support. This can be through individual talk therapy, group therapy, support groups that are in person, support groups that are online, or any other form of emotional support they may have. Seeking treatment is not the only task of a person diagnosed with syphilis. There is further management they need to continue with. Once a person is diagnosed with syphilis, they need to notify all their sexual partners so they can be tested and treated for syphilis as well. And that includes all of their current partners and any past partners from within the last year, because a person can't always be sure of when they specifically contracted the syphilis infection. They also need to abstain from sexual contact with any new partners. If a person chooses to continue to have sex with their current partner, they should make sure that it is only safe, protected sex to prevent the further transmission or to prevent the syphilis from being passed back and forth between the two partners. There's also further follow-up care. Once treatment has begun, more testing will need to be done, including blood work and exams. This is to make sure that the treatment is effective and that the person is responding to it properly.
Where to seek help. Syphilis and other sexually transmitted diseases, testing and treatment are available at many neighborhood clinics that offer free services or low cost for most clients. First is the Stockton Health Center, which provides non judgmental and confidential testing and treatment. It is located at 1601 East Hazleton Avenue, Stockton, California 95205. They are open Monday to Friday, 8 a.m. to 12 p.m. and 1 p.m. to 5 p.m., except for Wednesday, which open at 10 a.m. to 2 p.m. and 3 p.m. to 6 p.m. Do not forget to call their phone number at 209-468-3830 for appointment scheduling. Second is Community Medical Centers, Incorporated, which is a federally funded health center that is dedicated to bringing medical care to underserved and low-income patients. More than half of their patients have their services paid for by Medico, and they also provide a sliding scale fee system for those who are uninsured. Sites can be found at different locations. Call their office number to make an appointment. Third is Planned Parenthood clinics, which also provide confidential STD testing and treatment. They are located at different locations. For more information about syphilis, visit the Centers for Disease Control and Prevention website at www.cdc.gov/std/syphilis or contact them at 800 232-6348. They have brochures written both in English and Spanish.
And that concludes our presentation on syphilis. Thank you for lasting this long, and I hope you learned something new.